the events of the last day really reflect the vigilance that we have in our systems, right? So we have a safety net for reasons. There's scrutiny and monitoring for adverse events, and the system is working for us. 6 events were detected. They're concerning out of almost 7 million doses of the Johnson & Johnson vaccine, and that we were able to see our federal colleagues recognize this, respond really quickly, and make a call to action, I think does provide reassurance to those who think that the system may not be as rigorous as it should be.
Now also have data that actually shows the effectiveness in reducing in real patients hospitalizations, deaths, and transmissions. We have great data from a large cohort in Israel where they've been vaccinating using the Pfizer vaccine liberally. We have really good data from healthcare providers here in the United States showing this reduces hospitalization and death. And like David said, we have a wealth of safety data now from those other 2 mRNA vaccines. So, I would point people in that direction to say we have averted tens of thousands of deaths statistically already because of what we've done. And whilst this is important, this should not be a pause on those other ones, quite the opposite.
Periods of time where Johnston Memorial was full to the brim with people sick with COVID. People were transferred to Duke and UNC regularly on ventilators to our ICUs from Johnston Memorial and from other hospitals. So we know that COVID-19 can make people sick, that the side effects from COVID-19, which include clotting, we saw many people get COVID-19 and get sick. Many more than 6 people got clots due to COVID-19. So on the balance of things, it's probably more, it's prudent to get vaccinated against COVID-19 if you want to avoid a clot than to not get vaccinated. The benefits of these vaccines really do clearly outweigh risks. We knew there would be risks. You can't get away scot-free. And so now we're finding out with millions and millions, over 125 million people administered a COVID-19 vaccine in the United States, we're going to find the very, very rare adverse event. That may be what we're seeing right now. We don't know that. More investigation has to be done. We don't know about underlying conditions. We don't know about other medications. So I think we can't jump to conclusions just yet. But even if these 6 cases or additional cases emerge of this particular clotting problem, in the context of the benefits of the vaccine, we really do have to keep messaging that it's important for people to get vaccinated.